New tonight, Tennessee is part of what researchers call a suicide belt. We live in what is known as a suicide belt here in Tennessee, and researchers at East Tennessee State University found Tennessee is among a dozen states with relatively high suicide rates.
They found those rates were higher in rural communities. The study also identified common trends such as lack of access to mental health resources and a stigma related to treatment.
10 News reporter Lauren Lovett joins us. You looked at this study and some reaction to it, Lauren.
John, Robin, the people I talked with say it's difficult to hear, but even harder knowing that trend isn't improving. They say even in areas with enough mental health professionals, it can be hard to find or ask for help.
He had bright red hair. You could see him across the room or down the street.
Candace Bannister's son, Will, took his life over 8 years ago. He was a sophomore at Farragut High School. The community attended his funeral and that of 5 other teenagers within the next 2 years.
There are a lot more pressures on our youth now than there used to be, and I don't see that we are equalizing that with any support.
Bannister says that support is needed now more than ever, as numbers have gone up after her son's death. Now, Tennessee is considered one of 12 states with relatively high suicide rates, placing it within the nation's suicide belt.
Tennessee has a lot of rural areas, and we know that there's a correlation or a relationship between the number of mental health providers that there are in an area and the rates of suicide.
Sharon Boland is a mental health practitioner and professor at the University of Tennessee. She says there are many reasons why rates are high. One is lack of access.
This is a real underserved population, people with mental health issues. And what we know is people that get mental health care get better.
Boland says possible solutions could be more support groups, stricter gun laws, and satellite hospitals. It's something Bannister would like to see.
Attending a teenager's funeral is traumatic for the whole community. The first time it happens, you think, oh, okay. The second time it happens, by the 6th time it happens, you're looking around thinking, how do we keep this from happening anymore? How do we stop this?
Boland says cuts to Medicaid by the Trump administration make fighting this trend more difficult. But she says that means providers will just have to get more creative with how they assist people in need. John, Robin.
Lauren, thank you for sharing that story.